as Crohn's disease fundamentally is a result of an overactive immune system leading to chronic bowel inflammation and damage, treatment has to be targeted at calming the immune system in order to heal the bowel. The majority of children with Crohn's disease at the time of diagnosis have at least moderately severe disease severity scores. I will discuss some treatment strategies for moderately severe Crohn's disease. The idea with therapy is to induce remission firstly, which means getting you well, and then to maintain remission, which means keeping you well. The mission is remission. The choices of treatments that we have to induce remission, i.e. getting you well, are firstly, steroids, second, exclusive enteral nutrition, and thirdly, biologics. We'll go through them one by one. Firstly, steroids. What are steroids? These are very effective anti-inflammatory medications, but repeated use or prolonged usage can lead to unwanted side effects such as growth retardation, which is especially concerning in children who are already growth retarded from Crohn's disease itself. So the idea is to use steroids to get you well quickly so that the dose of steroids can be reduced gradually. Hence, there is a need for a second medication to keep the child well once he or she is eventually off steroids. The second treatment strategy to get you well is called exclusive enteral nutrition, or EEN for short. This is an alternative strategy whereby a child is placed on an exclusive liquid diet with a nutritionally complete formula for a total duration of 6 to 8 weeks. Besides the formula, he or she is only allowed to drink plain water or clear broth with no consumption of any solid food for that duration. The way it works is still not quite clear, but if one can imagine, this strict diet reverts you to the time when you were a baby, just drinking formula milk or breast milk all day. EEN likely resets the unhealthy gut environment of a child with Crohn's disease by increasing the proportion of good bacteria versus bad bacteria in the gut flora. EEN is highly effective, working just as well as steroids, if not better, with the advantage of improving a child's growth with literally no side effects. It, however, obviously is not a permanent cure, and just like steroids, the child needs another medication after the course of EEN to stay well. So we come to the next treatment strategy, biologics. Biologics are really the game changers in the treatment of IBD. It is by far the most effective treatment in pediatric Crohn's disease with a relatively low incidence of side effects. This is because these are man-made antibodies that directly mop up the specific chemicals, i.e. the bad guys, in the body that cause inflammation. It is like putting in policemen into your body, and these policemen are trained to catch a specific bad guy or criminal without causing harm to innocent people. This means this is very targeted treatment, as you can see here, without having to suppress the entire immune system. The ones we are most familiar with in pediatrics are biologics from the anti-TNF family, simply because these are biologics that are targeted against the inflammatory chemical or bad guy, so to speak, TNF. For children presenting with perianal fistulas or severe growth retardation from the start, anti-TNF biologics would be the treatment of choice because of its established effectiveness. Unlike steroids or exclusive enteral nutrition, biologics can serve both as a medication to induce remission as well as a medication to maintain remission. Besides biologics to maintain remission, there are two other commonly used medications. One is azathioprine. This is an oral medication that is taken daily. Second is methotrexate, which is often given as a weekly subcutaneous injection through the skin. These are effective medications that are suitable to be taken on a long-term basis in order to stay well in remission. These medications do not have the same side effects as steroids, so they can be used in place of steroids to keep you well. As with many immunosuppressive medication, your doctor would need to monitor your blood counts and liver function tests every now and then to monitor for any unwanted side effects. I must say that treatment of a child with Crohn's disease is not limited to immunosuppression alone. It is a multidisciplinary effort involving several other healthcare individuals, such as the dietitian, the endocrinologist, and maybe the psychologist. This is because a child has various care needs that range from appropriate nutritional supplementation to allow for catch-up growth, treatment of anemia and vitamin deficiencies, to improve fatigue, quality of life, and bone health, as well as management of pubertal delay, for instance. In addition to physical health, the importance of a child's emotional well-being and psychological health in the course of a chronic disease like Crohn's disease cannot be understated in this day and age, where due care should be made readily available. In addition to physical health, the importance of a child's emotional well-being and psychological health in the course of a chronic disease like IBD cannot be understated in this day and age, where due care should be made readily available.